Hello and welcome. This is Dr. Jerry Cuomo. I'm broadcasting live here in my Boca Raton office. We are doing sealants today on our patient. They're all going to be on second molars. We'll start with the upper right second molar first. Tooth number 2. So she's graduated from the pediatric office and now she's with me, and we noticed that her second molars were in need of protection, so prevention, protection. So first thing we're going to do is we're going to go in and just do a slight fissurotomy, just basically going to clean out the grooves from any bioburden products. So here we go. I'm going to zoom in. My dental assistant, she's just going to double check, make sure I'm in focus. So just hang in there with me. All right. So that's the lower, here comes the upper. That should be right in focus for everyone, so here we go. Alright, and now we'll just go gently into the groove and we're going to clean it out. Lightly touching this groove, by the way, just cleaning out any byproducts. The central pit, I'll go in a little bit on the primary, secondary anatomy. It's very, very slight. And then come over here in the groove. I'm barely touching it. Alright. I'm going to switch power again. I'm going to slide over to the lingual aspect now. I'm going to have her close and then open. Bring your chin up now. Great. Stay nice and wide. I'm going to come right over on the lingual aspect. And we're cleaning out this groove. We're going to be sealing it up. So this is not a filling. It's more prevention. So the idea, you still have to maintain a good isolation when you're doing the procedure. And you want to get good extension. Something as simple as a sealant can be a problem if it's not done correctly. So fissurotomy, very light. Okay, now I'm going to take something called concepsus and I'm just going to suction only. Get right up in there with your suction. That's it. And now we're just cleaning all that up. This is an in-spiral brush from Ultradent. So Conceptus, Ultradent's products are really good products. So, we just take this, we mark them, Conceptus, put it in a 3 millimeter or 3 cc pre-comp syringe. Tip on the end, brush on the end. Easy enough. Now we're going to rinse all that off. And then we're going to use tooth conditioner. Another Ultradent product we like to use. And this one is Total Etch. Excuse me, this is Bisco phosphoric acid etchant with 37%. So that's going to go on for approximately 10 to 15 seconds. Here we go. We'll get a small brush to scrub it in with. Open nice and wide. Keep it open. Everybody's doing great. Assistant's doing great. Patient's doing great. I'm doing great. Here we go. I want to wish everybody a happy Thanksgiving out there. And we pray for peace. That's what we're praying for. Peace amongst everybody. And blessings to everyone. Here we go. A little rinsing now. Now we're going to stay in there with the suction, but we're going to use something called an air-air syringe. Alright. So here comes the air-air syringe. There's absolutely no water going to this. This is all air, filtered air. Okay. Perfect. Out, please. Great. And I'm going to rinse a little bit more. I see a little bit on that lingual. I'm just going to rinse it off. Just make sure we don't have anything there. And then I'm going to come in and dry again. Let's see if I make it. It needs just a little more etch. Right at the last, see, right, I'll show you where it is. Right on that lingual. You're okay underneath? All right, here we go. Okay. Right there. See, the chalky appearance is kind of nice to see that. There we go. There are other programs and other videos that I've shown about rubber dam use, so that all helps. Rubber dam use helps. Okay, now we're good to go. Keep it nice and open now. Perfect. Now we're going to lower the light gets turned down on the microscope to about less than a watt of power. Not enough to cure it. Here it comes. Now I'm going to dry it again. See a little moisture starting to trick around. I want to make sure there's no moisture whatsoever. Now we're going to get real close. Now I'm putting actually an adhesive in there. Can you believe this? We're going to use an adhesive. Some sealants don't require that, but I like this because we're going to use a flowable material. And it'll be bleach shade. So it'll be a little stronger than that of a sealant. Again, I'm thinning this down for a reason. I want to thin it down because we don't want to pool this adhesive in there because she's going to get something extra special. Now I'm just going to put my special goggles on. And for viewers out there, we'll put a filter on that lens. Here comes the filter for the lens. Please. Thank you. Thank you. And we need another triangle right away. This, we can light cure between 10 and 15 seconds. That's all you need. LED light. Transfer. Transfer. Suction, please. Okay, here we go. See how nice that is? That's ready. Now comes the flowable. We're going to use bleach shade flowable. I'm just got to wipe off my mirror here with tissue. Come right back in for you. We'll squeeze a little bit out first. This is a sealant called Wave SDI product. Nice product it is. Open wide. Open nice and wide. Thank you. Thank you. I'll squeeze some out now. Okay. And right down the groove. Look at that. Nice flowable. Open wide. Explorer's next. Open wide. Thank you. Keep it open. Okay, now I'm taking an Explorer. I want to make sure there's no bubbles caught in there. My dental assistant's going to retract the tongue. There you go. Okay, I'm going to wipe off some excess here so we don't put too much in. Just enough. I'll even use a perio probe. Just keeping it in the groove, that's the key. Keep it in the groove. Open wide. Yeah, second molars are a little bit of a challenge because, you know, you got it way back there. And she's doing a great job staying open for us. Now I'm going to light cure again. Dental assistant's going to cover the lens. And she'll keep it covered for the duration of 30 seconds. And she won't remove it until the light gets turned off. Then she'll remove the filter, so your eyes are all protected. All right, so that's that. Now we're going to just check her bite and make sure everything is comfortable. It should be 100% comfortable. And voila, those teeth are now, that tooth is going to be sealed for hopefully the rest of her life. She won't ever have to worry about tooth decay. She still has to brush her teeth, and don't get me wrong, floss, know everything, but tooth will not be as susceptible. May I please have the light up? All right, so this is the finished product. Nicely done. Look at how nice and shiny that is. We'll take a real close look how it's well sealed. All those grooves now sealed beautifully. All right, secondary anatomy as well. Beautiful. All right, this is Dr. Jerry Cuomo. Thank you for watching today. I appreciate your tuning in. Again, happy Thanksgiving to everybody out there. Enjoy your families and keep practicing.